The former Dr. Feelgood guitarist Wilko Johnson, who's 66, was diagnosed with cancer just before Christmas last year. He's been told it's terminal, but he's rejected chemotherapy, and we can talk to him now. Hello to you, Wilko.
Hello.
Thank you very much for talking to us. Also, we've got Gary Matthews with us, 52-year-old Gary, who was diagnosed with thymoma 8 years ago. That's when tumours affect the thymus gland, which sit behind the breastbone in the chest cavity. He believed he'd recovered, yet 7 months ago it came back. He had an operation and was advised to have more chemotherapy, but says he can't face it again. Gary, good morning to you. Welcome to the programme.
Good morning.
And we'll also hear from Chris Twelves, Professor of Oncology at the University of Leeds. Welcome to you.
Good morning.
Wilko Johnson, tell our listeners about the time when you were told you had cancer.
As you said, it was Christmas last year. My son had actually dragged me into A&E because I had this lump in my stomach, and I'd been treating it by ignoring it and hoping it would go away. So I went in and they did tests on me, and one day went in and they told me that I'd got cancer and that it was inoperable. And actually I felt remarkably calm, completely calm. They told me that they could use chemotherapy, and chemotherapy. They told me that I had about 10 months to live, and with chemotherapy maybe a year. Now I know chemotherapy makes you very, very ill, and I thought, well, I'm feeling fit and fine at the moment. How long will that last? And they said, well, maybe you've got a few months of that. So I thought the decision was quite easy. Yeah. Chemotherapy could do no more than extend my life by a relatively short period. And I thought I'd just rather enjoy the health that was left to me, and not have treatment. Let the disease take its course.
And how are you feeling at the moment?
I'm feeling fine. You see, the 10 months have gone by, and I'm still feeling fine. The tumour continues to grow, but I'm not really feeling any ill effects. And I've had a wonderful year. I've managed to do well. I did a farewell tour in April, and at the end of that tour I was still okay. So I've spent the summer doing playing at festivals in the UK and Japan, and I'm hoping to be spared a bit longer to do some more recording. When the disease will kick in and do its stuff, I don't know now. They told me I would be dead by now.
Did your wife's experience of cancer influence your decisions?
No, no. It just seemed the decision in my case. It just seemed a fairly obvious thing to do. You know, they said, they could inflict this terrible suffering on me and maybe extend my life by a couple of months. It just didn't. It didn't seem worth it.
Yeah.
I'm very, very glad that, in fact, that I rejected chemotherapy. As I say, I've had a wonderful year. Travelled, looking up old acquaintances, and generally, I think that cancer comes, it's going to kill you. And you can either look at it like, people often talk about a brave fight against cancer. And that's not been my way of approaching it, really. My way has been to accept the cancer, realise what, that's what's happening, that any fight against it really is a losing battle.
Yes.
And rather than have my whole consciousness preoccupied with trying to get rid of this thing, just realising, no, I accept what's going to happen, and I'm very grateful for these last few months that I've had.
I think you have used the phrase "feeling euphoric." Can you explain what you mean?
Well, as I said, when they gave me the diagnosis, I felt absolutely calm. It was as if he was telling me something I'd known all my life. And kind of walked out of the hospital in a little bit of a daze, I suppose, and looked at the sky and the trees, and just suddenly it just felt so wonderful to be alive. And but by the time I walked home, by the time I got home, I was absolutely tingling with the euphoria of being alive. And I suppose, you know, when you the idea that death is imminent really makes you realise you're alive, and what a wonderful thing it is to be alive. And I was going along on this high for quite some time, and I think it's true to say that during this year, you know, my whole consciousness has changed. It might make you look at everything a little bit differently, and yeah, I think I'm a happier person probably now than I have been for years and years.
Well, that's extraordinary and absolutely glorious to hear, I have to say. Gary, I wonder if you can relate to what Wilko's saying in any particular way?
Yeah, definitely. It does make you obviously have an whole new outlook on your life. It makes you realise that the small things that you worry about really nothing to worry about. It makes you respect life more. Your family mean more to you, that are around you, and yeah, I can relate to that, definitely.
And what did the medical professionals around you say when you refused more chemotherapy, when this came back?
With my cancer, it's quite a rare one, and when I was speaking to the oncologist at Guy's, he said there's no hard and fast rule, because it's such a rare cancer that he can't go to a book and say, yes, you definitely need to have it, or no, you don't need to have it. He said, really and truly, the decision is down to you. But obviously we had to go away, and me, the wife, and my daughter, we had to sit down and have a chat and decide what we was going to do.
Through your work, you're a funeral director, you meet a lot of families affected by cancer.
Definitely.
Has that influenced you?
To a degree, I would say. It's taken the sting out of it, if you like, of passing away. It doesn't really worry me as such now, as much as it used to. And I know that, you know, I've got a good family around me, and whatever help I need, or Alison, my wife, and Holly, my daughter, they're going to be there for them to help them.
Wilko, I suppose, I don't know if you think this, but when I look at your musical career and the various things you've done, it feels like you've lived so many different lives anyway. Feel Good, going solo, the Blockheads, and so on and so forth. Is that fair?
I must say that this last year has caused me to obviously look back on my life, and I have to say that I have had a wonderful life, and in a way I can accept things now by thinking, well, man, you know, to ask for more would be actually greedy. And you know, I'm 66. I've lived a fairly long life, and I'm still going round and playing rock and roll, and yeah, what can I say? I'm a happy man.
Are there some songs? Are there some bits of your music that perhaps mean more to you now because of this particular experience, or not really?
No, I think you definitely step into a different kind of consciousness. You look on everything differently. So all of my past experience and things like that, they're all in that other world, you know. I call it BC, you know, before cancer. That was my life then, and this is my life now. It's kind of, it's not lonely, although one does feel very, very alone. but I don't feel that. I mean, I've got my friends and my family. I'm certain that it's far worse for them than it is for me. And I mean, I lost my wife nearly 10 years ago to cancer, and the experience of seeing her die, yes, that was dreadful. But now, as I say, it's my friends and family that are suffering those kind of regrets. I'm just I'm just happy to still be around, and how much longer we don't know. But yeah, I really can't complain.
We'll talk more in a moment to both of you. Wilko Johnson is with us, as is Gary Matthews. Both have terminal cancer, both have rejected chemotherapy, and they've been explaining their reasons why, amongst other things. We'll hear from the Professor of Oncology at Leeds University in a moment. And your experience is welcome, of course, 0500 909 693, particularly if you have decided to leave chemotherapy and the reasons why. Let's bring you some travel now here on 5 Live. Here are some messages, particularly for Wilko Johnson. Dave has texted to say, it's not just a career, Wilko. You have brought pleasure to millions. You are a special man. David Foray on Twitter says, Wilko Johnson is on 5 Live right now and being amazing. John Welsh says, Wilko Johnson being generally excellent on 5 Live right now. Ollie Iron has quoted you, Wilko Johnson tingling with the euphoria of being alive after being given 10 months to live. And lots of people actually inspired by your attitude. I don't know how you react to that, Wilko.
Many people have told me this, actually, that they've found inspiration in some of the things I've said, which, well, what can I say? That I'm glad, but my whole attitude and the way I've reacted to it is not something that I thought out. It's just an immediate reaction. That's the way I feel. If other people can find some strength in anything I've said, then good.
Some friends of mine went to see you in Camden the other Sunday night, and they've seen you before. This time, they said, because of your illness, there was a greater intensity they felt to your performance. Does it feel like that for you or not?
It's when we started playing in festivals this summer, somebody who's known me for an agent, actually, who's been familiar with me for many years, came up and said he'd never seen me enjoying a performance so much, and I think he was right. You know, when you're playing and you realise that, well, one, that this might be the last one, you know, or you know that, well, this is the end, but it extends all across life. All of this, all of the kicks you can get in life, and that they're all made them more piquant by this knowledge. So yeah, I'm certainly enjoying playing gigs now in a way that I never did before.
Let's bring in Chris Twelves then, Professor of Oncology. Hello to you, Professor.
Good morning.
I know you've been listening carefully to Gary and Wilko. And their circumstances are particular to them, of course. Do you understand when patients reject chemotherapy?
Well, it's always sobering and at times inspiring listening to people with cancer, and these are the sort of discussions that, as an oncologist, I have with patients on a daily basis. And I think what we would seek to do is to make sure that each individual patient has all the necessary information to make the right decision for them. We heard in the introduction that there are situations, usually with cancers that have been caught at a relatively early stage, there are situations where chemotherapy is indeed curative. Patients, for example, with breast cancer that has spread to the lymph glands, we know that that chemotherapy and some patients hormone therapy can reduce by between a third and a half the risk of that woman dying of her cancer. So there are very real, very major benefits. The situation is sadly different for many of the common adult cancers once the cancer has become more widespread. We have the situation that we've heard about this morning, where chemotherapy would be given with the intention of prolonging a patient's life, but isn't realistically going to give us the opportunity to cure the patient. And we would want to be sure that patients understood the limitations of what we could achieve, the potential side effects, but I must say we wouldn't want patients to be experiencing terrible toxicities with chemotherapy, especially in the situation where we know that we can't cure them, where maintaining or improving their quality of life is of paramount importance. We'd be doing all we could to minimise those side effects, and indeed if the side effects prove so severe as to interfere with that patient's getting on with their daily life, then we'd have to question very much with the patient whether it was appropriate to continue.
Why can it make a patient feel so ill?
These are drugs which don't home in only on the cancer cells. They do spread through the body. They affect the bone marrow, so the blood count can fall. The patient can feel tired or experience infection. Patients can get a sore mouth. They can get diarrhea. But this Monday morning in the breast clinic which I did, I saw myself a dozen patients, many of those patients on chemotherapy, and most of them getting on with their everyday life to a greater or lesser extent. So we shouldn't certainly trivialise the potential side effects of chemotherapy, and every patient must make the decision that is right for them. But equally, it wouldn't be correct to say that chemotherapy wipes patients' lives out for everybody.
Will it be the way we treat cancer for the foreseeable future, do you believe?
I think it will remain a very important part. Some 30 years ago, when I started as in oncology, we hoped that the cancer drugs, the chemotherapy drugs, would become so good that patients would no longer require surgery, and that hasn't been the case. Surgery, radiotherapy, and chemotherapy remain the most important treatments, and it depends on the particular type of cancer, the extent of the cancer, how we use those different treatments. We're seeing new so-called targeted drugs being developed that are based on our better understanding of what makes cancer cells tick. And in some cancers where, for example, chemotherapy really isn't very effective, such as melanoma or kidney cancer, these new targeted therapies have really made a huge difference. But in other diseases, and the cancer I treat in particular, breast cancer, these new targeted therapies are very often used alongside chemotherapy, because given together they are better than either used on their own.
Thank you very much for your time, Chris Twells, Professor of Oncology at the University of Leeds. Gary, how do you approach each day at the moment?
Really, as it comes. Each day is a blessing, and I try to make the most of it.
Wilko, what would you say when you wake up in the morning? What do you think?
Well, the first thing that happens when you wake up is that you remember you've got cancer. I don't know, it changes from day to day, you know. One thing that I've found is that really the best thing is to be with friends. So if I'm not actually working or anything, go out down to the Railway Hotel in Southend, where many of my friends will be gathered, and just be with people. You know, you can get, obviously you get dark nights of the soul when you're on your own in the middle of the night, but you've got to go through that. But generally, I think the thing, get out and about and see your mates.
Can I read some more messages to you both? This listener says, they haven't left their name, my brother was diagnosed with inoperable pancreatic cancer earlier in the year, and he and the rest of the family have found Wilko an inspiration. Beryl says, I had breast cancer 6 years ago. I've been clear since. I had an operation and radiotherapy. But if I had been told chemotherapy would have given me 6 months more, I would have bitten their hands off to have longer with my children and grandchildren. Your two guests today, talking on your programme today, are incredibly brave, and they're making me cry. Let me read this. These guys are making me feel good to be alive, says Margie. Another listener says, once again, I'm humbled by the lives of others. Inspiring to hear Wilko and Gary on the radio. And that's from Andrea in Bristol. Can I thank you both very much for talking to us this morning? It's been uplifting, which is not necessarily what I expected, but thank you so much, Wilko. Thanks for coming on the programme.
Thank you.
Gary, I wish you all the best. Thank you so much.
Thank you very much.
Thanks for your time.